Measuring impacts and prioritizing policies for recovery. As COVID-19 spread across the globe in early 2020, governments had to make difficult policy choices to balance the socioeconomic costs of social distancing and lockdown measures on the one hand, and the human costs of increased morbidity and mortality of an unchecked pandemic on the other. The challenge was particularly daunting for developing countries with their often ill-equipped and underfunded health systems, coupled with general skepticism about the effectiveness of economic restrictions to curb viral spread, especially in densely populated informal urban communities. Poorer developing country populations also tend to be less resilient to income shocks, while the social protection measures needed to mitigate against income losses are costly. With developing country governments already heavily indebted before the pandemic and with further anticipated losses in tax revenues due to COVID-related economic restrictions, their ability to finance palliative measures without sacrificing much-needed longer-term public investments has remained a major concern. Countries adopted broadly similar measures to reduce the spread of COVID-19, all entailing restrictions on movement and physical interaction of people through limits on travel, social distancing, or in more extreme cases, shutting down non-essential economic activities. While governments had some control over these domestic measures, they could do little to shield their economies from disruptions in global supply chains and commodity markets and weakening demand for their exports. With their lower levels of economic diversification and resilience on a limited range of export commodities for foreign exchange earnings, developing countries were expected to be particularly vulnerable to these global shocks. Given uncertainty about the likely economic impacts of COVID-19 restrictions and external shocks, IFPRI's country modeling team worked with government partners, local think tanks, and IFPRI country programs to evaluate the short-run economic costs of COVID-19 in a number of developing countries. Social accounting matrix, or SAM, multiplier models for each country were used to trace the direct and indirect or spillover effects of policy-induced or external shocks along and across supply chains. The short-run analysis was designed to assess the exposure of national food systems to COVID-19 shocks, identify vulnerable sectors, workers, or population groups, and recommend policies to mitigate risks to livelihoods and food security. Following these initial analyses, a second phase of the project will identify policy and public investment priorities for economic recovery from the pandemic over the 2021 to 2025 period. For those analyses, single-country computable general equilibrium models will be deployed. To date, in addition to global CGE modeling analysis of the impacts of COVID-19 on poverty, IFPRI has undertaken COVID-19 country modeling analyses in 29 countries, and analysis is ongoing in 6 additional countries. Most of these studies adopted a SAM multiplier model framework developed by the IFPRI country modeling team and were directly supported or led by the country modeling team. A social accounting matrix is an economy-wide database that captures resource flows associated with all economic transactions between all agents in an economy, households, producers, or government during a calendar year. This provides a snapshot of the structure of an economy at a point in time. SAM-based multiplier models are used to translate exogenous changes in final demand into endogenous changes in domestic production. Changes in production in one sector can have spillover effects for other sectors that supply intermediate inputs to the expanding sector. By capturing input-output relationships, these potentially important spillover effects are measured in SAM multiplier models. They further capture employment changes as well as employment-induced changes in household incomes. Although SAM multiplier models have several limitations, they are ideally suited in simulating COVID-19 shocks. This is because COVID-19 entailed simultaneous disruptions to demand and supply, where market mechanisms ceased to function normally and equilibrium could not be reestablished through price adjustments. The project note shown on this slide synthesizes results for 18 of the 29 completed studies. The same approach is adopted to simulate the impact of COVID-19 induced shocks in all 18 countries. Shocks are imposed as demand or supply shocks in each of the 86 economic sectors in the SAM. Shock values were informed by country experts and based on the design and enforcement of domestic restrictions. All potential domestic impact channels were considered, including, for example, temporary closure of manufacturing or trade operations, closure of restaurants or movie theaters, limitations on public transport or border closures, or banning of public gatherings. External shocks, in turn, were informed by published evidence or projected shocks to private remittances, foreign direct investments, or international trade flows. In conclusion, COVID-19 has had devastating economic impacts around the globe. IFPRI's multi-country impact assessments based on SAM multiplier modeling provide a more detailed understanding of the extent of these losses as well as their distributional implications. A useful feature of these models is that they're easily updated as new information becomes available. Currently, for example, several countries are already requesting additional analysis of the effects of the second, third, and fourth waves of the pandemic. See our latest results here on our website for more information. Thanks very much.